Today I would like to explain the difference between mastectomy and chest wall masculinization. As you know, I perform a large number of male chest wall masculinization for our female to male patient, transgender patient in Toronto, and this for 25 years. So the term mastectomy is a medical term that just refers to removal of breast tissue. So we do that when I do my female to male patient. We do that when we remove a tumor in a breast. It's called a mastectomy. And we can even extend that term to gynecomastia, where a man has what we call man's boobs, and we remove the breast tissue. It's also called a mastectomy. Now, when I come in as an aesthetic plastic surgeon doing chest wall masculinization, is I will create a final product, a final result that will look masculine. That means in my hands, we do chest wall contouring. So I will do liposuction in that, what we call the outer pectoral triangle, so that we get a clean triangular definition of the pectoralis muscle. So liposuction is part of the masculinization. Another important component of this masculinization is the size of the areola. The areola is the circle around the nipple, and an areola in a male is approximately 25 to 28 millimeter in diameter. So that's important to bring the larger areola to a smaller areola. And the last and final, and I think it's actually the second final, is the placement of this nipple areolar complex, which should be approximately 20 millimeter above the fold. If you look at a muscular bodybuilder guy, he has a fold, and the nipple areolar complex is approximately 2 centimeters above the fold. So that's number 3. And number 4 is to place the incision where the pectoralis muscle attaches itself. So when we do the incision, often the double incision procedure, we see where the pectoralis muscle attaches, and I like to anchor the incision right at the insertion to recreate the real anatomy. And if I could add a 5th part to this, would be to create a scar that looks like a hockey stick. So this is a nuance I've added over the years, where in the old days we would create a semicircular, a smiling kind of incision, which also always reminds us of a circle or a breast. So I've changed this into a hockey stick. Because I'm Canadian, we call it a hockey stick incision, where the incision is somewhat straighter and angulates out towards the underarm area to create a hockey stick kind of incision, but also it recreates what the normal pectoralis muscle border is. And finally, if you really want to be fancy, sometimes patients want to get a bigger pec at the same time, and occasionally we do a pec implant at the same time, and that would complete all the procedures available, all the nuances available for our transgender patient here at Visage Clinic. Thank you.